Welcome. To those joining us live and to those listening afterwards, welcome to the 6th episode of the FIP digital programme on the FIP Development Goals, setting goals for the decade ahead. Today's episode is about FIP Development Goal number 21, Sustainability in Pharmacy. Let me first introduce myself. To those of you who don't know me, my name is Dr. Catherine Duggan. I'm the FIP Chief Executive Officer. I celebrated my 3rd anniversary in post last week. It's been a rollercoaster journey so far, not likely to stop. I'd like to hand over to my colleague and co-moderator, Lina. Over to you.
Thank you very much for that, Catherine. My name is Lina Badr. I'm the FIP lead for Workforce Transformation and Development. I'm talking to you today from Saudi Arabia. Sorry, from Jordan, actually. I just came here over the weekend. We're so not used to travel. I'm also the lead for DG 21 Sustainability and really pleased to be with you today, co-moderating with our CEO, Catherine. I just want to start by going through some housekeeping slides with you and giving you a little bit of a background about this program and where this event fits within. Some really basic announcements, just to let you know this event is being recorded and live streamed via YouTube. The recording will be available on our website, events.fip.org. You may please feel free to ask questions using the question box provided. If you have questions, use the question Q&A box you can see in the panel and use the chat for any other comments and introductions. You are, of course, welcome to provide feedback on this event to the email on screen. And of course, if you aren't already, please consider becoming a member of FIP to enjoy the full benefits of FIP membership. So let's begin by briefly introducing you to this digital program, Setting Goals for the Decade Ahead. This is episode 6 of 21 episodes. This program is a comprehensive online event series. It provides coverage of the 21 FIP development goals over 21 events in 2021. The outcome of the 21 events is to really mobilize global pharmacy development and transformation using the development goals as a framework for that. We want to engage you and members in our profession and colleagues everywhere and aim to provide and describe direct and context for each specific goal. Monitoring and evaluating through data and evidence is an important component of today's event as well, and all other episodes of this program. As you see here, an outline of the events spread throughout this year. We are in June. This is the 6th episode. We have about 2 events per month, with September being a particularly busy month. During World Pharmacy Week, we'll be hosting around 4 episodes. So we're really looking forward to that. And our episode finale will be in December, and it will be focused around impact and outcomes. We'll feature other really key outcomes and launches as well. In case you aren't familiar with the FIP development goals, and we really hope you are, they are our 1 FIP goals that bring together pharmacy practice, science, and workforce and education. At FIP, we believe that we can have no pharmaceutical care without a properly trained pharmaceutical workforce, and we can have no care or a workforce without a really strong scientific foundation that underpins the work we do over the next decades. These are the 21 goals. You'll see the first 13 goals build on the workforce development goals we have developed at FIP back in 2016. We have built on the consensus-based methodology that underpins that and expanded the set of 13 into 21 you see on screen, each now reflecting a practice, science, as well as a workforce and education element. The next video will just run you through the the FIP development goals. our 21 goals, please visit our website for more information. In the next slide, I'll actually hand back over to my co-moderator, Catherine, to provide with some context before we hear from our panelists. Catherine, back to you.
Thanks so much, Lina. So, colleagues, while this is the 21st of the 21 development goals, in many ways, this may be the most complex goal that we have in our menu. Many components and relations to other areas of practice exist within sustainability, and it's almost the encompassing role and suitably situated at number 21. We will evidence this through the coming presentations. So the outcomes for today's event are to describe the development goals and explain the components of DG 21 and its three elements: workforce and education, science and practice, to showcase the FIP tools, the evidence and resources that support DG 21 implementation across those three elements, to identify priorities across practice, science and workforce and education within DG 21, and to engage you all in an activity to support monitoring and evaluation of the goal through data and evidence. Quite a busy event for you. So I mentioned to you earlier, it's an ambitious goal for us. In pharmacy, many of the other development goals have direct and immediate applicability to our priorities and strategies. I mean, patient-centered care, academic capacity, antimicrobial stewardship is directly applicable to practice that we undertake daily, dependent on our scope and our sector of work. Sustainability is not an easy one to pin down, with lots under its scope. However, as we expanded the pharmaceutical workforce development goals and we developed new development goals during 2020, the year of the pandemic, it became completely apparent that patient care and public health are only achievable if we also focus on sustainability. So if pharmacy is to play its role in universal health coverage, we too must consider the sustainability of our workforce, our services, our role in education and management in areas such as air pollution, management of waste medicines, as well as the impact we have on our environments and beyond. I wanted just to highlight to you that sustainability as an encompassing goal is not new to FIP. Probably what's new is the way in which we have consolidated it under one development goal. Over the years, FIP has had programs of work that align with sustainability in pharmacy agenda. A number of outputs contribute to implementation of the Development Goal 21 by supporting our members with addressing their needs. Some examples include, firstly, the access to medicines is integral to sustainability in pharmacy. And in 2013, we reported on the FIP International Summit on Medicine Shortages. Secondly, in 2015, we published our first guidelines on green pharmacy, which we will discuss with you today. Thirdly, our Global Trends Shaping Pharmacy report on data from 2013 to 15 on regulatory frameworks and medicines distributions were all concepts linked to sustainable services. Fourthly, remuneration of pharmacy services is integral to sustainable practice, and our 2015 report provided a global overview of remuneration models across the world. In 2016, we developed policy briefings that address pharmacy ownership and medicines distribution. Again, both are policy aspects that need to be part of the sustainability discussion, never more pertinent than during the COVID crisis. Then we readdressed medicine shortages in 2017 in a report on the same topic. The role of pharmacists in the supply chain was the focus of a report in 2018. And most recently, we've published a global survey on how pharmacists can mitigate the impact of air pollution on health, very much an environmental issue, which will also be addressed today. FIP is working with the Clean Breathing Institute, the third year that we've been working with them, and other partners to further this work. This will result in a call to action to be released on Air Pollution Day in September of this year. Lina mentioned September is a busy month. And it's really important to note that sustainability as a concept is ingrained in the global development that UN support. Indeed, the UN Sustainable Development Goals are, in fact, described as sustainable goals. The SDGs are a blueprint to achieve a better and more sustainable future for all. So at FIP, we want to support innovation, we want to support new ways of working, and then we want to make sure that they are sustained. and sustainable over time. This only emphasises the importance of our DG21 sustainability in pharmacy, and we're super pleased to be hosting this event today to facilitate discussion on this issue in pharmacy, and for you in the event to be able to think how that applies to you, your country, your sector of work, your environment, and your scope of practice. So we're super delighted to welcome our esteemed speakers today. And we've got a very big range of topics under discussion. Today, we will look at sustainability as a whole with Eva. Saja will describe sustainability in the context of workforce and education. Susan will follow and emphasize the integration of the whole pharmacy team in the workforce. Eduardo and Manjiri will provide us with examples on sustainable services in their nations and in their scopes of practice. And Eva and Sandeep will round us off with sustainability from the angle of both environment and planetary health, literally global discussion. Once they're done, we will have a panel discussion. So please put all your questions into the chat box and we will round them up as we move forward. Thanks a million. It's my great pleasure to introduce Eva Salami. Eva graduated from the Helsinki University as Master of Pharmacy in 1982. Her interests have always been in the field of managing change of the pharmacy profession, from the traditional dispensing role to the public health supporter role. For this, the continuing education, the service development, and the research on managing change have been her main interest and passion in her professional life. This happened in the local, the national, and the international levels where pharmacist roles in promotion on public health have been defined. Eva is a certified coach and a pharmacy owner of Pharmacy 7 Brothers. She's an FIP fellow, a former member of the FIP Bureau. She stepped down last year, the Board of Pharmacy Practice, Community Pharmacy Section, Professional Secretary and Board Member of several task groups, Green Pharmacy Practice, GPP, etc. Eva was also on board and task force member, president of the WHO Europharm Forum. Eva, it's so lovely to have you here with us today. The floor is yours.
Thank you, Catherine, and thank you for the invitation to discuss with you today these sustainability issues. These are very close to my heart, and I'm very happy and proud to be here today. May I have the first slide? So we have a kind of a philosophic discussion here before we go to the examples, so that what do we understand with sustainability? Because you have a little bit like two angles in looking at this, which you could also see that the United Nations have sustainable development goals instead of having just development goals. And so I think we can see here that the sustainability in the general speaking, it covers the economic, the societal, and the environmental policies and principles of organizations and companies. And in this, it's a little bit like ethics. It covers all the actions taken by the organization or a company to reach and support sustainable development in that organization or a company. And this is a very broad thing. So you have to, when you are doing your sustainability reporting, let's say, for example, in FIP or in our pharmaceutical organizations, so you have to cover all these actions, what you are doing, so that you develop the sustainable development in your economic perspective, in the societal perspective, and in the environmental point of view. So this is the how could I say the normal how we understand the sustainability. And then we have this what we are discussing today also, which is very much focused on the sustainability of the pharmacy systems. So the workforce formation, the research and drug development, and pharmacy practice. And here we can see that the sustainability is reached through the rules and regulations and of the societies. So in this case, it's a part of the society's sustainability politics. And we really need all these policies to guarantee accessibility and affordability to pharmaceutical services. So I think this is a wonderful mixed matrix. We can see a matrix here where we can see on all our three elements and the pharmaceutical sciences, the pharmaceutical practice, and the education. And then we also can see the policies and principles in the economic, societal, and environmental aspects. And if we, when we are discussing this, we really need to look at this in a holistic and integrated approach to cover all these areas. And in the next slide, we can see there are listed here what kind of things we have put under this workforce and education element. There are the strategies and systems in place that utilize the workforce to enhance sustainable pharmacy and services. We have the practice element, where we have the policies, regulations, and strategies to ensure the sustainability aspects of both the environment and minimize the impact of pharmaceuticals and pharmacy practice, but also the appropriate mechanism to ensure the sustainability of pharmacy practice itself, which is the thing I already explained here. And then we have the third, the science element, where we have all these scientific strategies and policies in place to maintain consistency in this way of the supply of medicinal products throughout their life cycle in a sustainable way. And in the next slide, we can see that on the left side, there is the ecology and environment, there is the social responsibility and the economic responsibility, whereas in the right side, we have this other part of the matrix, the rules and regulations, integrated services and teams, workforce and education capacity, and access to pharmaceutical services, where we have to then imply these sustainability aspects. So this is a really huge thing. And during this webinar, we will now get examples on how the sustainability aspects have been integrated to all these pharmacy 3 elements: education, science, and practice. Included in this slide deck, we also have a little in-depth explanation about these sustainability goals. We are not going to discuss them today. You will get them with the presentations later. Thank you.
Thank you very much, Eva, for that really helpful overview ahead of us starting with some examples. And really pleased to introduce the first example, which is looking at sustainability in the context of pharmaceutical workforce and education. So really focusing on that first element that Eva has just mentioned. And I'm very pleased to introduce our speaker for this example, Dr. Seja Nahar. Dr. Seja Nahar is an assistant professor at Pharmacy Practice Division in the Faculty of Pharmacy in Yarmouk University in Jordan, and also associate researcher at the Center of Health Innovation, Leadership and Learning, CHIL, in the Business School, University of Nottingham. In January 2019, Dr. Nahar was appointed as the technical coordinator for the FIP project of pharmacy workforce development in Jordan. Dr. Nahar completed her bachelor degree in pharmacy from Jordan University in 2009. In 2012, she has obtained a master's degree in health service management from the Royal College of Surgeons in Ireland and Yarmouk University. In 2014, Dr. Nahar started a PhD degree in social and administrative pharmacy at the University of Nottingham, which was completed in 2019. In addition to her academic record, Dr. Nahar has practical experience as chemotherapy pharmacist at King Hussein Cancer Center. Following her time at KHCC, she worked at Hikma Pharmaceuticals, where she took roles in research, development, medical affairs, and compliance. Dr. Nahar is also the lead for Pharmacy Intelligence DG 12 goal at the FIP Workforce Development Hub. Dr. Seja, welcome, and the floor is yours. Saja, just letting you know we can't hear you. I'm not sure if we still have Saja with us on the line.
Can you hear me now?
Yes, we can. Thank you.
Okay, so thank you, Dr. Badr, for the introduction, and good afternoon for everyone. Greetings from Jordan, where it's really hot and sunny today. First, I would like to thank the organizing committee for inviting me and offering me this opportunity to participate in the webinar. It's such a pleasure and honor. Today, I'm going to talk about the sustainability in pharmacy in terms of workforce development and planning. In general, achieving sustainability in pharmacy workforce should be guided by policies and interventions that are evidence-based and context-specific. This can be actualized by several mechanisms targeting academia and research, integrated services, workforce intelligence, policy development. These mechanisms are interlinked and affected by each other. Therefore, it's not possible to discuss each one in isolation from the others. First, I will start talking about the academia and research mechanisms. Academic programs should be able to produce pharmacists who have the right skills, right knowledge, and right competencies to meet the market needs and requirements. This can be achieved by adopting a research agenda that is based on actual collaboration with practicing pharmacists who are in the field, who can give a realistic and honest account of the profession, challenges, area for improvement, and future aspects. Pharmacy academics and researchers should tailor their research projects in a way that is able to address urgent and challenging issues of the pharmacy profession in their country. Adopting research agenda that is based on actual and active collaboration with practicing pharmacists and relevant stakeholders such as patients and other healthcare professionals might achieve this. The outcomes and the results of the research should then be reflected and used in developing academic programs and curricula and training programs as well. Second, next slide, please, Lina. The next one, please. Secondly, I'm going to talk about integrated services. According to the World Health Organization, integrated service delivery is the organization and the management of health services so that people get the care they need and when they need it in a way that is user-friendly, achieve the desired results, and provide value for money. Understanding the local demand by developing deep and thorough understanding of local context and its needs. This is also supported by academia and research. Engaging relevant stakeholders, mainly patients, in identifying local needs and demands. So we will have a person-centered assessment, care, and support. Tailoring the pharmacy workforce supply in a way that is able to satisfy the local needs and the requirements through context-specific academic programs. So that, based on what was discussed in the academic-related mechanisms. Next slide, please. Thirdly, the workforce intelligence. Workforce planning is defined as the process of analyzing, forecasting, and planning workforce supply and demand, assessing gaps and determining target talent management and determining target talent management interventions to ensure that an organization has the right people, the right pharmacists, with the right skills, in the right place, at the right time, to fulfill its mandate and strategic objectives. This should be the mission and the vision of pharmacy profession associations. Workforce intelligence should not be limited to reporting the number of practicing pharmacists and calculating their density only. It should be actively used in workforce planning. There is a need to expand the workforce intelligence scope to capture the available skill mix, identify specialized and advanced practitioners, and identify the gap in skill mix. Finally, policy development. Next slide, please. Policymakers should ensure that there is a sufficient number of qualified, mission-driven pharmacists are available and ready to practice in different sectors. Policymakers and professional leaders need to develop comprehensive policies and legislative pathways. Policies should be able to provide dynamic, needs-based approaches for developing and advance the profession nationally. policies should address workforce planning, workforce development, workforce well-being and safety, and education. That's it for me.
Thank you very much, Seja, for that very brief but really, really key messages there. And it's really great to see how you have managed to also explain sustainability in the context of workforce education through the lens of other development goals. And I think in the next presentation by Susan, this will be further emphasized, the interlinks between sustainability and some of the other goals. I'm very pleased to introduce our next panelist then, Susan. Susan James is the Director of Quality at the Ontario College of Pharmacists, which is the regulatory body in Ontario for pharmacists, pharmacy technicians, and pharmacies. As a member of the senior executive team, her portfolio includes entry to practice and continued competency, community and hospital practice, pharmacy assessments, and strategic policy and analytics. During her tenure at the college, Susan has been instrumental in the implementation of regulated pharmacy technicians and continues to promote the integration of technicians within pharmacy practice locally, nationally, and internationally. She is the current chair of the FIP Pharmacy Technicians Advisory Committee and Pharmacy Technicians Support Workforce Strategic Platform, which currently sits under the Workforce Development Hub. Susan holds a master's degree in public administration and a Bachelor of Science in occupational therapy. Susan has worked in professional regulation for over 20 years, having worked previously as a healthcare clinician, administrator, and lecturer. Susan, thank you so much for joining us. I'll hand over the floor to you.
Thank you very much, Lina. And thank you very much to FIP, to Catherine as well, for inviting me as well to participate in today's session. Likewise, very dear to my heart. And I am going to talk about what I consider to be the true backbone of the workforce, and that's people. Remembering that we are delivering services to people, and that is by people. So really, without us, without the people, there is no workforce, and there would be no need for a workforce if we didn't have those people that are requiring healthcare services. So let's talk a little bit more about what that looks like. And remember that always at the center of this, those people are complex, both on the delivery side and on the healthcare needs side. We are all within different systems. We have different networks that we are connected to and have multiple complex needs. So while we're going to focus a little bit on the pharmaceutical workforce, I want to always stay focused as well on the fact that we are a part of a much broader system. And for sustainability in our work, it is important to remember that we are a part of that complex and broader system. Both for patients and for those of us delivering care. Next slide, please, Lina. So when I talk about the pharmaceutical workforce, I think it's really important to understand what the true definition of that is. And what you see here is the definition that FIP has confirmed for the pharmaceutical workforce. And really just to point out that it is broad. It refers to the whole of the pharmacy-related workforce. So it is pharmacist practitioners, pharmaceutical scientists, pharmacy technicians, other pharmacy support workforce cadres, pre-service students, trainees, very broad in terms of roles. And important to note that it is also recognizing that these individuals work in a diversity of settings. You can see a number of them there. And that is reflective of a diversity of scopes of practice. So again, I think that we want to make sure that we are thinking about the breadth of the pharmaceutical workforce. You heard certainly that I have a focus in one of these particular areas, although I work broadly with all of them. And again, as much as we're focusing on this, we must never forget that the pharmaceutical workforce is only one piece of the much broader healthcare workforce that we are a part of. I will also just reinforce that this definition, and whenever we're talking about the workforce, we have to put that into the context of the particular country, the region, the local region, and understand that what that workforce will look like will reflect the needs of that particular community, the needs of those patients that are in that community, the resources that are available. And again, I think that if we are going to talk about sustainability of this workforce, we have to understand that it has to have the right skill mix. We have to be connected to the other parts of the system as necessary. The next slide, please. So I just want to touch very briefly on the particular elements. There are the three elements that you have heard about, and you've heard a little bit about the workforce and education element in terms of the mechanisms. I'm also going to touch on practice and science, and really have just highlighted here the fact that without the workforce and thinking about people, and again, all aspects of the workforce, these goals are just so closely linked to people, and it requires people and the different roles that we've just talked about in order to actually fulfill these mechanisms. So aligning with education, we have to have a workforce that, as I said, has the skill mix, has the competencies that we need, and to develop that integrated service. There has to be capacity. That's a workforce. We have to train that workforce in order to be able to provide the services. And engagement, obviously, is a reflection of members. We have to engage all aspects of our workforce if we truly are going to be sustainable moving forward. In terms of practice, you'll also see that there are multiple aspects here that reflect the importance of the individuals, the people, the different roles of the workforce in order to fulfill these mechanisms, advocating for and contributing to the development of the policies. It takes all aspects of the workforce to advocate and to contribute in that sense. And again, here it reflects all aspects of pharmacy practice. And likewise, in terms of the sustainability, the economical sustainability, that's everybody that needs to be involved. And you can see it again in science. In fact, with the science, everything here speaks about the workforce, all aspects of the workforce, all of the stakeholders that need to come together in order to fulfill these mechanisms. And so on to the next slide. When you think about all of that, I do want to speak a little bit about some of the other goals. And you can see on this slide that there are multiple development goals that do address workforce sustainability. Many of these are related to what I would consider the human factor. The collaboration, partnerships, recognition of individuals, focusing on interprofessional and intra-professional relationships, again, within pharmacy, outside of pharmacy, understanding people, keeping an eye to that people-centered care and inclusivity. So 4 goals there that are very directly linked. And while I consider those to be very much the human factors, there are also, sort of reflecting on what Eva spoke about, also those system factors, and a number of goals that reflect that, looking at the competency development, academic capacity, understanding impact. We need to have pharmacy intelligence and policy development. So truly, for sustainability of our workforce, we do need to focus on all of these goals. And the good news is that FIP has already established through these various development goals a strong link to that workforce. I'd like to just share one brief example in the next slide that shows one of the activities that FIP is very involved in that I consider definitely work to demonstrate the sustainability of the workforce. And that is the effort that is underway in terms of developing the pharmacy technician and the support workforce. We do have a advisory committee. You can see the aim there. It is to provide guidance and to work on truly the development of this workforce and ensuring that it is integrated within FIP, within the mission, much more broadly to ensure that it is an integrated and a part of that broad definition of the pharmaceutical workforce. I'm not going to get into details here. I will tell you that the group started in 2019. We had our first meeting with about 10 people in Abu Dhabi. And since then, we have grown and have a full structure. We have more than doubled people, and you can see a number of countries that are engaged. There are multiple initiatives that are under these various work streams. And this is just a really good example that is demonstrating if we truly want to achieve workforce sustainability, this is one area that we have to strengthen. It's an important aspect of the work team, and therefore we have to strengthen all of the aspects that this group of workers contribute. And so finally, just to say that our work is so well aligned. When you go to the next slide, you'll see that really across the FIP development goals, there are multiple places. In fact, you could argue that the pharmacy support workforce really is connected to all of these goals. The ones that are highlighted are some of the ones that we are particularly focused on right now. Many of them are about the workforce development itself, as well as those areas that are particularly related to practice, and that's where the integration of the team comes into play, and recognizing that the pharmacy support workforce has much to contribute in that regard. And I'll leave it there. Thank you.
Thank you so much, Susan, for that very complimentary presentation to what Seja has started on workforce sustainability. I think it's really important to recognize, as you've said, what we have and what it takes, so that we can focus our efforts in moving forward. And it's, of course, always remembering people being at the center of everything we do. Thank you so much. And I think talking about people and how we care for them, we're going to move on to our next panelists who will talk a little bit more about services in pharmacies and sustainability within that. So I'm really pleased to introduce our next panelist, Eduardo Savio. Dr. Eduardo Savio is the president of the Pharmaceutical Forum of the Americas. The forum's vision is the strengthening of pharmaceutical practice in the region, with emphasis on the pharmacist's role in national public health policies. He has served at the International Pharmaceutical Federation in different capacities, all the way from 2006 through 2017. He was a member of the steering committee of the Global Conference for the Future of Hospital Pharmacy, and received the Donald E. Franke Medal from ASHP in 2013. He has been very internationally active, with more than 150 presentations in international conferences. And I think with today, it's more than 151 presentations. Eduardo, thank you so much for being with us, and I'll hand over the mic to you.
Thank you, Lina, for the introduction. Thank you, Catherine, for considering me and inviting me to participate of this event. I really consider that sustainability is a complex issue, as Eva has introduced, and there are economical, social, and environmental considerations. And I am not sure if I have achieved or if I have a right to have an holistic perspective. So for me, in a hard issue, the best thing is to link to our real life and to practical examples. So next, please. In terms of access to pharmaceutical service, I think that COVID-19 antigen tests could be an excellent example. It is quite common that we arrive to read in the newspaper or somewhere this kind of news that, for example, an antigen test is going to be sold in petrol station. This is a news that was published last week in Irish Times, and that the Circle K chain of filling station is due to start selling the 15 minutes antigen test. And this can call our attention in different ways. And it can, from a national or regional perspective, what is happening in each country with this issue. What is the difference to perform an antigen test in a pharmacy? The next, please. So what is if we perform a COVID-19 antigen test in pharmacies, even that it could be an auto test, it is performed under the surveillance of a qualified staff, whether it is a technician or pharmacist, and the result of this test have different consequences that if the same activity is performed at home, and the people has the right to say, okay, with the result I introduce in a national platform, or I keep the result for myself. all the kit's elements should be properly manipulated and has a potential and biologically contaminated sample that should be discarded according to current local regulations in order to minimize the impact on the environment. So here it appear environmental considerations. The result could be positive or it could be negative. But from the pharmacist's perspective, it should be reported to the national health system because it's data that have an epidemiological importance. And so taking into consideration the social perspective, this is the ultimate goal to control the evolution of the pandemic. And with the negative result in case of in and out of test, the purpose is to have access to some kind of event. It can be a social, cultural, or sport event. But this certificate should be delivered to enable a person to participate in this kind of events. So this has to be instrumented in terms of national level or regional level to have these electronic certifications. And finally, it has an economic perspective, not only because it's enabled to come back to normal life in different aspects, but also who is interested and who should pay for this service. Is the pocket money of the people? Is the health system that has to pay for this kind of service? Or has the government be part of a general policy in order to come back to regular life? So even small things have to be considered in a political framework that have to take into account the three dimensions that Eva has mentioned. The next, please. In terms of self-medication and self-care, also FIP is working in this perspective and is part of working on health. And the first questions that we have to ask, do we have in our countries protocols in order to common aidment with non-prescription medicines, that this is almost an almost universal thing? It is accepted that self-care and responsible self-medication is beneficial for patients and health systems. And it is also recognized that self-medication must be accompanied by appropriate health information. So now we know, and it is worldwide available, that information technologies offer a wide range of possibilities. And we always say, okay, but pharmacists' input must mean or should mean an added value. When the expensive OTC medicines is in every country instrumented, implemented 2-3 minutes interview to add this health information? Do we have protocols and do we work with these minor elements protocols? Do we have support to the pharmacy team to participate and to add the information in every act related to OTC? Do we work in self-care and self-medication with suitable support and with suitable information behind? Next, please. And finally, you know that antimicrobial stewardship is a big issue. And the services in pharmacy has to evolve because still we do not have suitable tools to work. And in the next future, it will appear a lot of new tools. And one of the issues is the phenotypic antimicrobial resistance that we need to have tests. And in this area, there are challenges that the point of care methodology is an evolving issue, and the technology of microfluidics is considering new alternatives. And if we take into consideration what bacteria and antimicrobials offer, there are challenges that in one hand, we have the phenotypic considerations, and in the other hand, we have the phenotypical considerations. And in terms of phenotypical, we have functional antimicrobial susceptibility test that the traditional ones through froze microfluidic or this diffusion takes quite a long time, so 1 or 2 days at least. And now they are appearing phenotypical microfluidic through digital microscopic in certain numbers of hours, less than 7 hours. On the other hand, the identifications of the gene-resistant mechanism that is present in different complex alternatives may take some hours, but this is some laboratory test. So there is a need to go faster, and there is a great need to have more portable diagnostic tools to help the selections of the antibiotics, because different reports describe that up to 20% at the least of prescribed antibiotics are not appropriate. So we need to have rapid, miniaturized, functional of phenotypic measurements of antimicrobial susceptibility, which are now being developed. One of these alternatives is the small forms applications to enhance usability of this kind of analysis through point of care testings. And this is with no doubt a great input to perform surveillance of antibiotic resistance in health, in agriculture, in environmental samples, and we need to monitor and better tackle the emergency of antimicrobial resistance. So pharmaceutical services related to point of care of antimicrobial resistance could be available in the next future, and we need to be prepared to use them and to put in place in pharmacy. So I hope that with these small and 3 examples linked to real life, we can put in place something that Eva mentioned. Sustainability has into consideration economic, has into consideration social. We have to give pharmacy services that are socially relevant, and they have a meaning in terms of political issues, and also it has a meaning for the environmental. Thank you very much.
Thank you so much, Eduardo. I couldn't sum it up better than you have just done. And I think it's really, really pertinent what you mentioned, working as well with all stakeholders, including government, as well as other health professions, to really ensure sustainable services. And with that link, I'm pleased to introduce our next speaker, Manjiri, who will actually talk us through how we should be aligning pharmacy services with national health priorities to ensure more sustainable practice. So very much an extension of some of the excellent examples that Eduardo has presented to us today. So let me introduce Manjiri before we hear from her. Mrs. Manjiri Garrett is an academic working with Prin KM Kundnani Pharmacy Polytechnic near Mumbai as the in-charge principal. She is the Vice President of Indian Pharmaceutical Association and Chairperson of Community Pharmacy Division of the association. She's also the Executive Committee member of the Southeast Asian Regional Pharmaceutical Forum of FIP WHO. She's the immediate past Vice President of Community Pharmacy Section at FIP. She's also newly elected Vice President of FIP. Apart from her academic and administrative responsibilities at her institute, Manjiri has been active in the area of community pharmacy and consumer medicine education. She was instrumental in establishing a public-private partnership engaging community pharmacists in tuberculosis DOTS program, which she'll speak to us about today. Mrs. Garrett is also involved in professional development of pharmacists through training them for various aspects of good pharmacy practice to help them play a vital role in public health and to promote responsible use of medicines by pharmacists and patients. She received the fellowship of the Indian Pharmaceutical Association and several other awards from international organizations, as well as national ones in her country. She's also the recipient of 2 global awards. One is FIP Fellow in 2016, and one is the Ishidat Award of Federation of Asian Pharmaceutical Associations. Thank you, Manjiri, very much for being with us today. I'm really looking forward to hear what you're about to say. The floor is yours.
Thank you so much, Lina. Thank you, FIP. Thank you, Catherine, for this kind invitation. Very happy to share my experiences of developing the sustainable pharmacy services in Indian community pharmacies. I bring you greetings from Mumbai, India, and we have heavy rains here, the monsoon. I hope my internet stays stable throughout my presentation. Can I have next slide, please? While talking about the sustainable services, I'll be talking, focusing more on the social, societal, and economic sustainability around the pharmacy services of the FIP Development Goal 21, Sustainability in Pharmacy. Can I go to the next one? Next slide, please. So I'm going to take you back. I'm actually going to tell you a very quick story and a work of 15 years. I'm going to just bundle it up in a few minutes. And this is like 2004 when we had TB Fat Card project in Indian community pharmacies in Mumbai. And that was a private sector, the project focusing on the private sector, an awareness project through the community pharmacists. During that project, we developed a lot of insights regarding the national TB program in India. And TB is a major public health challenge in India with more than 1/4 of the global TB burden in India. So we realized that the National TB program has a strategy DOTS, directly observed treatment short course, where the patient has to go to the public health facility during the opening hours of that hospital, of the public health facility, and swallow the medicines in front of the health worker. So that was directly observed treatment short course, which was offered mainly through the government setups, and few private providers were made community providers, like the private dispensaries, private hospitals, and some shopkeepers. But to our surprise, the community pharmacists were never involved in the national TB program or any other national health program, and they were never given the responsibility, or that those services were never integrated in the national TB program as provider. This was like kind of shocking, surprising to us, as well as it created a lot of restlessness in us. Why not community pharmacies as a provider? Can I have next slide? Actually, the rationale or the thought process behind having the community pharmacists as providers was very clear. Pharmacists are the first point of contact. People with symptoms come to the pharmacy. So there is an opportunity for the early case detection and cutting disease transmission, longer opening hours, convenient location, friendly relationship with the public. So this could make the pharmacy as an ideal DOTS service provider, or the patient-centric DOTS services could be set up. That's what was our thought. Also, as Eduardo said, AMR has been a big issue in India. So through the pharmacist training, we thought we can contribute to the rational use of anti-TB drugs, as well as share the burden of the public health staff, the national TB program staff. All in all, we thought if we develop this model, if we develop these services through the pharmacies, we can increase the access, equity, quality, and cost effectiveness of the TB services for all. So with this rationale in our head, and next slide, please. With this rationale in our head and a lot of passion in our mind, we embarked on a journey in year 2006, where me and my team started meeting FDA, government TB authorities, Chemist Association, that is a traders association, and the individual pharmacists to know whether they would like to have such type of services. And they were all apprehensive. And I can perfectly understand that we were apprehensive too, because in India, the community pharmacies are more like drug sellers, medicine sellers than the healthcare professionals. So everybody was apprehensive whether pharmacists would like to have time spent for such type of services, etc. But since TB is a big problem, everybody said, let's try this model. And so we started with small number of pharmacists training in Mumbai. Actually, we called 25 pharmacists, but only 6 turned up for this training. And this training was conducted as a joint effort of IPA with local TB health officers. Next slide. As we moved forward in this direction, can I have the next slide? Whatever role we had envisioned for the pharmacists, it was coming true, like our dream was coming true. We got some initial success stories, like this pharmacist was close to urban slum, and he was referring many symptomatics to the health facility, and those were like, they were getting detected as pulmonary TB cases. Then the DOTS medicines were brought to his pharmacy, patient was coming to his pharmacy. So like what we realized that whatever model we had thought of, whatever pharmacy services we had thought of, that could be scaled up, and that is working model. Next one. So you can see this pharmacist of whom I'm very, can I have next slide, please? I'm very proud of these pharmacists who extended a great service to the patients. These are the DOTS TB medicine boxes, and they're counseling the patients. And the pharmacies were labeled as DOTS Center, like kind of an accreditation from the local TB offices. And they were not given great financial incentive, let me tell you that. But overall, this model fitted well in their routine, and then we could scale up these type of services. Next slide. So with that encouragement and the confidence that we developed through this initial pilot, we formalized the structured role of the pharmacist. We developed the training module for community pharmacists in TB with our experience of couple of years. And I'm glad to tell you that Government of India adopted this training module, and it was published as a joint publication of IPA and Government of India in year 2030. We kept moving forward in this direction, and we scaled up this effort. Can I have the next slide? So as we scaled up this effort, I can tell you this is like over next 5 years. And I can tell you beginning with only 6 pharmacists in Mumbai, we could scale it up by 2012 to 500 plus pharmacists. And by 2015, reaching 3,000 plus pharmacists in 6 states of the country. And in the background, government realized the role of pharmacists and the services, and they made an MOU with IPA, including the pharmacist in the National TB program. This was a historic happening because never before pharmacists were involved in or engaged by government in any public health program. So with this MOU, the pharmacists were officially welcomed. Those were the first footprints of the pharmacist in any public health program. And therefore, though we started very modestly, very small, but the government integrated their services in the DOTS services in the National TB program, this could become sustainable. I mean, when we started this project, we never wanted it to stop. Like we never wanted it to remain as a project. Like when the funding dries up and then when our attention is focused to other area, the services could have just stopped. But we wanted it to run as a practice. And this is what could happen. The pharmacists who were trained in year like 2006, 2007, were still giving the services as DOT provider or referring the cases even in 2015 and 16. Next slide. As the DOTS program is undergoing transition right now, the pharmacist model had changed, and now we need to renew our MOU with the government. We'll be doing that soon, but the pharmacists are now realized as an important health resource by the government, and so their services will be continued to the community. From this experience of like 15 years of developing pharmacy TB services and establishing this model, I can confidently say that the pharmacists contribute to the TB program, and not only the TB program, we can extend it to the other public health programs benefiting the community. National Pharmaceutical Association can play a significant role in developing new pharmacy services, even though there would be a lot of challenges, struggle, hindrances. If we work with positive outlook, and if we work with patience and perseverance, we can definitely achieve something. The journey of 1,000 miles starts with the small steps. So we need to take those steps and move forward in the direction. Pharmacists can be made available as new pole of human resources for the public health benefit. And overall, these type of services given by the pharmacists can increase the equity, access to care, and developing the sustainable services is possible. And I want to thank FIP because when we started developing this model in year 2006, 7, 8, 10, 12, when we scaled it up, FIP always supported us in dissemination of this information worldwide through the FIP congresses. And that's why this public-private partnership model became known to the world, known to WHO, who also took the, who paid attention to this model and asked us to develop a toolkit for the same model. So thank you very much. And maybe after a few years, I'll bring you the next part of the story. If you want to read this entire project, the short story, you can go to ipapharma.org and can read through this handbook. Thank you very much.
Manjiri, thank you so much, and congratulations for this excellent program. of work. It is such a success. It's such a great story, and we think it will be much less than 3 years and for another update. Manjiri, with your pace, I think it will be a few weeks. Thank you for that. This is an excellent example of how important it is to invest in public-private partnerships to ensure sustainability of services and development of new advanced services in pharmacy as well. Thanks, Manjiri. We now step into the next two final examples of our event, which focus around environment and planetary health. So I'm going to re-invite Eva back to the stage again, please, the digital stage. Eva, thank you so much. I'll hand over to you.
Thank you. And can I have the first slide, please? So I will tell you about the Generation Green project, as we call it, in the Helsinki University Pharmacy Faculty, which started in 2015, based on this report, what you can see in the other side of this slide, which was produced by FIP as a reference document, Green Pharmacy Practice. And based on this, FIP also, the council accepted the statement on the green pharmacy practice. And somehow this was for us in Finland and in Helsinki University Pharmacy Faculty, this report was the starting point for a project which has grown up to a huge task force nowadays. And it has had 3 goals from the beginning. And these 3 goals are to integrate the environmental issues to all pharmacy education, and to promote research on the environmental impact of active pharmaceutical ingredients and pharmaceuticals. And thirdly, to collaborate with all stakeholders to promote regulation where also the environmental aspects of pharmaceuticals are taken into the consideration. And I can mention here that this kind of needs to promote regulation are in the fields of public procurement, on the pricing, on rational prescribing and use of medicines. And if we look at these 3 different active areas, so first the education. In the next slide, please. So our starting point in this whole Generation Green issue was to really integrate to the education all the environmental issues. So we saw very clearly that it's not possible to educate environmental pharmacy in one specific course, but this has to be integrated to all pharmacy courses. And we wanted to develop a model which could be then iterated also in other higher education, so that we could produce a practice change model or a teaching change model or a curriculum change model, which could be applicable also in other higher education than pharmacy. And we have also managed to produce this kind of a model. So we have nowadays on board also the medical faculty in our work in the Generation Green. So what happens in the education today are that students do learn the principles of green chemistry, green drug research and development, green technologies and recycling, together with rational pharmacotherapies. And students also used to actively use their knowledge of environmental sustainability in their future working places, which is of course the goal of the education. And to just raise the general awareness so the teachers can mark their courses with this green leaf you can see here to mark the environmental contents. And as I already mentioned, the integration can be used in every higher education. And we have also described this in a scientific article in the Sustainable Chemistry and Pharmacy number 16, where you can find more information if you are interested. In the next slide, I will explain about the research part of this Generation Green project. So we have had several big research projects where Generation Green also is participating. And these are not only in the Helsinki University Pharmacy Faculty, but they are run together with the educational officials or models with other universities, and even in the EU level with different universities. And now our very interesting goal is to work to establish a permanent professorship in pharmacy faculty on the environmentally sustainable pharmacy. And by our knowledge, this is the first one of its kind in the world. And we really hope that this will, when we got all the money for the professorship, that this will then give the possibility to the pharmacists around the world to benefit from this green pharmacy professorship and about this professorship. So there are also several research reports published and research seminars organized, both for students and researchers, both nationally and internationally. And we are going to start an international Master of Pharmacy program in the pharmacy faculty, and that is mainly focused on this environmentally sustainable pharmacy practice or pharmacy. And then the third part, which is the collaboration with other stakeholders. So we've annually have organized several webinars or seminars, so far it was possible, or other educational events where medicines and their environmental effects are discussed. So these covered the contents about environmental effects of active pharmaceutical ingredients. We also tell about these international programs, which there are in the European Union level, which there are about the antibiotic resistance problem, which WHO together with the United Nations is running on the topic. And we spread information about the different activities practicing pharmacists can take. So we have education and collaboration in the different levels to the different stakeholders. So we have organized this, for medical industry representatives, for researchers, for wastewater organizations, for practicing pharmacists, etc. And we also work in close collaboration with the medical and environmental institutions in Finland and in European Union. And we also have some support with the members of parliament, both in the Finnish parliament and in the EU. So this is quite a big project. It has become bigger and bigger during the years, a little bit like Manjiri's thing. And we are now quite in the place we have to consolidate this in a way. What is then the future activities, the role of the future activities in this? They are in the next slide. And this is about the FIP level now. So I think personally that what we need in a future to provide also a global platform for all the different stakeholders who are interested in the environmental sustainability issues, which are really important part, for example, in the antibiotic resistance problems and in the One Health actions, and also in the as we saw in the beginning, the air pollution issues, etc., etc. So I think we really need a space in FIP where these environmental issues could be discussed, and this information will be shared in this specific area by all the interested pharmacists. So I look forward that this sustainability discussion also will have this goal. And I think this is essential, as the environmental impact of medicines is a global issue, and also the solutions are global. We cannot solve anything only in Finland. When something happens in the atmosphere, it goes through the whole world, and we have to have global solutions. And I think we have a role here to play also. We have to participate very actively to the discussion going on in the United Nations, in the WHO, in the other stakeholders, and bring our specific pharmaceutical knowledge, because the environmental impact of APIs, for example, is not very well known, and we have a lot of specific information on this issue to the tables where environmental sustainability is discussed. So thank you. That was my short presentation about our project. If you want to have some more knowledge about that, I'm ready to answer to the questions. Thank you.
Thank you so much, Eva, for that, and for all of your contributions to FIP's work, as well as implementing that locally. We do have some comments saying that it's really good to see how the environmental issues are being integrated into pharmacy education. That's from Angela, South Africa, and some more comments from her. So this is really, really important, and I hope we are going to start getting some more Q&As now. We are moving on to our final speaker, Sandeep, who will talk about planetary health. So again, an extension of the environmental issues, but maybe with a little bit of a different flavor. Sandeep, I'm very pleased to introduce you. Dr. Sandeep Maharaj is a pharmacist and has done his graduate studies in business management. He serves as a lecturer in the School of Pharmacy and also as the Associate Dean Distance Education and Planning Directorship of the Entrepreneurship and Business Transformation Office for the faculty at his university in Trinidad and Tobago. Dr. Maharaj is the PAHA's Global Outreach Fellow at the Planetary Health Alliance, which is based in the Harvard T. Chan School of Public Health. He has also been appointed to the Leadership Committee for Clinicians for Planetary Health. Sandeep, we are really excited to have you here with us today. Thank you for joining us. And we're really looking forward to hearing more about what you have to say in terms of why should planetary health matter to us as pharmacists. Thank you so much.
Thank you very much, Lina, and it's a pleasure. And again, to Catherine for having me here this morning. And I know everyone was worried that I did not have a single word of pharmacist or pharmacy stated on my slides. But as we move along, I'll try to make it as relevant as possible. Could we move on to the next slide, please? So as we can see, planetary health is a discipline where human civilization and the natural systems which depend on each other, we look at the health of both of them. And as we know, and my diagram on my right, your left, more than likely, the humans have just appeared on the earth. But more importantly, they are creating something called the Anthropocene epoch, whereby it's a new epoch being placed outside their new time period where humans are impacting upon the actual health and the planet on which we live and driving that whole current 1,200 years recently of basically the planet actions. And as we move on to the next slide, we'll see, as we move on to the next slide, pharmacists have obviously played a major role in us defining this epoch as all health professionals, because in defining this epoch, we have recognized that life expectancy has increased, and due to a lot of our great public health measures that have taken place, and child mortality has decreased. And similarly, over that same period, poverty and wealth wealth increased, poverty decreased. And due to that, persons' standard of living has increased, they are living longer, and at the end of the day, these cause some pressures on the environment. And these pressures are obviously carbon dioxide, increased ocean acidification, deforestation, increased demands for water and fertilizer to move us forward. And what does the future hold for us? So as we move to the next slide, we'll see the future. Basically, can we move to the next slide? Thanks. Our current trajectory states that we're about 7.7 million now. We are going to be about 9.6 billion, sorry, 7.67 billion now, 9.6 billion by about 2050. And what does 9.6 billion means for us? 9.6 billion means there's going to be an increased demand for grain, an increased demand for water, and an increased demand for services generally, as those things that we saw earlier. And pharmacists who have been ranked by Forbes, we were number 1 when I started the profession. I hope I didn't do too much damage to it, that it's now number 3, but it's still the number 3 profession when it comes to the world, trusted health professional, and they can play a significant role in allowing us to live possibly with 9.6 billion people, but at the same time ensure that they meet the demands of what is required as we move forward. So we move on to the next slide. So as you can see, where does the solutions lie? And I'll spend a little time here on dealing with the intricacies of pharmacy and how pharmacy can play a major role. The first thing, and I'm very happy the previous presenter spoke about this, education, education, education. Education of pharmacists, that there's a role and there's these issues that are happening. Their education of their patients to know that things need to be changed. And more importantly, education of our upcoming professionals for them to understand the different ways, just as you were doing, ensuring that people understand green pharmacy, for example, for our manufacturing sector, where they can play a role in ensuring 9.6 billion people can live comfortably and at the same time ensure the sustainability going forward. The other issue is reduce of food waste. Food waste, as one may note, 1/3 of the food produced last year would have gone into waste. And at the same time, 1 billion people, approximately 1 billion people, actually suffered from malnutrition or starvation during that same period of time. And it gives a great opportunity for pharmacists who are that frontline worker, that person that is dealing with the patient head on, to ensure that they get that information in. Healthy diets with a low environment impact. Pharmacists, you are the ones at the end of the day who has to do all the patient counseling, and we look at co-benefits. So places like the Caribbean, where CNCDs are a major issue, we are now trying to develop environmentally friendly CNCD type nutrition. I will skip better governance and come back to that at the end. Use of water, again, education. End of deforestation, again, education, but more importantly, note that as deforestation takes place for competition, the rise of antimicrobial resistance, the rise of new zoonotic diseases, and that interaction between human and animals are going to increase, and pharmacists need to, one, research for those new antimicrobials, and two, more importantly, guide persons to let them understand things such as Lyme disease. All of these types of issues are going to come to the fore, be well trained to deal with them. Family planning. Could the planet really handle 9.6 billion people? We don't know, but pharmacists have always played a major role in education, family planning as well, and hence they need to continue there. City planning. This is really a social critical issue that pharmacists need to play a role in. Why? You say, pharmacists, how do you think it's morally right to tell a patient to go outside, exercise, walk for 30 minutes a day, but there are no trees, the environment, the air quality is bad, and at the end of the day, we all know the impact of greenery and mental health also. There's a critical, there are critical studies there that shows it, as well as the cooling effect of trees for patients who suffer with heart disease. Pharmacists need to start pushing at planners, because if you need to educate and make sure that your patients are healthier and you have to advocate for your patients, cities must be built for those interventions that you need to take on behalf of your patients. Finally, I would like to talk about better governance. Fortunately, we are lucky enough here in Trinidad and Tobago, in my country, that one of our ex-students, my student as well, is currently the Minister of Health. And pharmacists has a role to play in better governance. We are trusted persons. We are persons that has a wealth of knowledge, and we need to ensure that at the end of the day, we get into governance and be able to place all of these great ideas for sustainability into it. As we move on to the next slide, as my time is now coming short. Next slide, please. I want you guys, if you have 2 minutes, to just look at the UNDP site. And I'd like to emphasize planetary health cuts across almost all 17 Sustainable Development Goals. From climate change, as number 15, straight up to education and so on. And where we need to go is to look at where we have co-benefits, such as climate, COVID, and planetary health. We need to look at where we can have co-creation of interventions. And at the end of the day, pharmacists play an important role as they are across the spectrum, the clinical spectrum, the community spectrum, the research spectrum. Very few professions can go into all of those areas. And hence, it is critical that we are able to look at where we can create co-benefits and co-create solutions. I end my presentation by just giving some references and the next slide where you can get some more in-depth information on what I'm speaking about. Next slide, please. And you can look at GOBA has done a call for collaborative pharmacy action, as well as myself and a team here in Trinidad and Tobago has called a rethink through a planetary health lens. And these publications have a number of interventions that pharmacists can take across the board. I do end my presentation here and thank each and every one for the opportunity to present. And everything that I said wrong goes to me, everything right goes to the FIP. Thank you.
Thank you. Thank you, Sandeep, for that really nice disclaimer. We will also take the fault with you, no worries. Thank you so much. We are actually coming up towards the end of the session, so I'm not sure we're going to have time for panel discussion, but I'm going to consult my co-moderator on this.
So, Lina, it's so super important that we gave the speakers that we had today the time that they needed to present for us. I've done my best in responding to the Q's and A's, and I must just say that there's a call for the space that Eva has been describing for us to discuss all of these important issues. There's a real alignment around the economic, the environmental, the holistic and the workforce issues. This concept of taking an example in practice and not piloting it, but proving that it can work, really shows from Manjiri and Eva and Eduardo what we can do in practice and how FIP can support. So it's down to us, Lina, to follow up on those Q's and A's and all those answers. What I suggest we do is we move to Chris to walk us through the exercise on data and intelligence, and I'll introduce Chris in a second. And then in my closing remarks, I'll give the floor to each of our speakers for one take-home priority message, literally a one-liner, and then we will close. So hopefully that will give us a bit of a nice way to round off. A super exciting event, Lina, and we're flexible and adaptable, which is what the profession needs to be. Thank you for that.
Thank you for that, Catherine. Chris, may we ask you to come to the stage and introduce yourself?
Thanks, Lina. Hello, everyone. I'm Chris John. I'm the lead for data and intelligence at FIP, and I'm going to talk very briefly about the Global Pharmaceutical Observatory. And we have a little activity for you, which we hope you will enjoy, and I'll come on to that in a moment. You've heard of the important work our speakers have been talking about, us moving towards Development Goal 21, sustainability in pharmacy. It's very important that we are able to monitor and evaluate that progress. So the GPO, the Global Pharmaceutical Observatory, is key to monitoring and evaluating our progress towards the Development Goals, and indeed Development Goal 21. And its mission centers around data, intelligence, advocacy, and reporting. We know the importance of data, and for data to provide us with evidence, and for evidence to provide us with intelligence. So our first task at the GPO is to always collate valid global data on workforce, education, practice, and pharmaceutical science. And we must undertake comprehensive analyses of collated data to provide accessible, high-quality intelligence. And all this must be communicated innovatively to promote our member organisations' impact on health. And you would have heard a lot about that from our speakers. This communication we provide will be via the FIP Atlas, which is our visualisation platform for displaying our intelligence across the globe. And we will be able to do this for Development Goal 21. And finally, we will provide evidence-based strategic information, reports, and guidance on the application of pharmaceutical science, policies, practices, and services. Next slide, please. So the FIP Global Pharmaceutical Observatory's outputs and influences will be sharing and disseminating intelligence that informs policy formation and advocates for the profession. That might be about environmental issues or remuneration or anything related to sustainability, using this development goal as an example, country monitoring, reporting and information comparisons, and these could be benchmarking for any of the topics that have been in discussion today, research and analysis, evaluation of trends to support action planning, and facilitating collaborative working and national and transnational networking, bringing in nations together to deliver transformational projects. We also will be undertaking evidence generation for capacity building. We talked about sustainability of the workforce today, and potential for linkages with other observatories such as the WHO's and others. Most importantly, today we are concerned with health system strengthening by tracking progress against development goals. Next slide, please. We have a number of projects underway related to the GPO. The META project is the first global pilot of mapping education and workforce needs assessment using the FIP Development Goals as a framing device. We're aiming for data retrieval. In fact, it's well underway in partnership with member organisations, and using the project to develop a comparative assessment in terms of priorities across regional commonalities. The main aim of this project is to address multinational needs-based education for the pharmaceutical workforce in a cohort of nations across the globe, and to evaluate policy gaps on a regular basis. As previously mentioned, we're also working on the Atlas, our visualization platform, to display important intelligence related to the development goals. And linked to this, we'll be developing a dedicated GPO website and database, which will serve as a repository for all the data. We are advised on the strategic direction of our work by the One FIP Data and Intelligence Commission, which meets regularly to discuss big ticket items that provide assurance and guidance on achieving the GPO vision and mission. And finally, and the reason why we are here today, we have an important project that aims to produce indicators that will measure and monitor progress towards the development goals, which is where you all come in. Next slide, please. So we have a short engagement activity for you. FIP is now seeking to develop indicators and country-level metrics to measure and monitor progress and the performance of the implementation of the FIP development goals. So during this event, we would like to seek your support for this Global Indicators and Metrics project by contributing to this brief activity linked to this current FIP digital event that you've joined. So we'd like to know your opinions on this development goal and how it can be monitored and measured. And this is a very quick and simple tick box exercise. You'll also receive an email to complete this activity after the end of this event if you don't get a chance to complete it during the event, but we would really appreciate it if you can have a go during the event. And there's a link on the screen now, and also a QR code that you can also link through to the activity. So thank you very much for your attention, and I will hand back to our moderators.
Thanks, Chris. So we'll be in touch. And again, being flexible and adaptable, could I ask our speakers to write their take-home message in our chat box so that we can record that afterwards, as I know we only have a minute or two left. Lina, at the start of our event, I mentioned that I saw Sustainability Development Goal as just not very easy to pin down, with a lot under its scope. But just because it's complex and involves so many issues, from economic, environmental, holistic, workforce, it's not by no means a reason to ignore it. What we need to do at FIP, and we've seen from our speakers and from our participants today, is to pull together all the work with a sustainability focus and build a framework which comprises the issues we identify, the related development goals that map onto it, as Susan rightly put forward, and then how we link these to the Sustainable Development Goals more widely. And then this framework can form a way to prioritise and pull together the evidence of impact in a systematic way. It also means we don't duplicate, which is also a sustainability issue. And if I may say, colleagues, it can do some of the things that I've seen on the Q&As, which includes commitments that we can make and then hold ourselves to account. Remember, colleagues, if pharmacy is to play its role in universal health coverage, we too must consider the sustainability of our workforce, services, and our role in education, and the management, air pollution, waste medicines, our impact on our environments and beyond. So despite this being a complex development goals, I must join Lina in commending and thanking our speakers. You've all done us proud. Thank you, Eva, Saja, Susan, Eduardo, Manjiri, Sandeep, and Eva again. A million thanks from all of us. If you can put your take-home messages in the chat box, then this will be recorded for posterity. Another sustainable action. And it's over to you, Lina, to take us through the final slides.
Thank you for that, Catherine. While our panelists send through their final messages, I'd like to invite everybody to our next and 7th episode in this series, which will focus on FIP DG number 9, continuing professional development strategies, again, dissecting that goal in all of its elements across workforce and education, practice and science. The episode will take place on the 23rd of June at 11 a.m. Central European time. You can pre-register already or register now through events.fip.org. So please do register, please spread the word. We look forward to having you there and having you with us on this journey of exploring the goals through this digital program. I'd like to echo my colleague Catherine and say thanks again. Please visit our website for all other events outside of this series and within. Thank you so much and have a good day, evening.